Hello, I'm Tate. I'm going to be doing the IV insertion checkoff. First thing that we'll do is we'll wash up our hands, use some hand sanitizer here, and then we'll go into our med room and verify the doctor's orders. So we can see on here that we have patient Frank Miller, date of birth is 7/4/1958, med number is 000911634. He's allergic to penicillin and atorvastatin. That's all matching up over here on his other date and time notes. This is the one of the orders here. We're to insert a peripheral IV as needed. We're also to administer 0.9% normal saline at a rate of 2 to 5 mLs into that IV as needed. So we'll begin by doing that. I'm gonna keep this with me and then grab some of my supplies. So for my supplies, I'll need 2 IV gauges or IV needles. For this scenario, I just have 1, but I'll grab 2. I'll also grab 2 Tegaderms just in case I contaminate one of them. With this IV needle, this is the one that we need. I have to just make sure that it's all intact. We'll also need 2 of these saline flushes. So they say 0.9% sodium chloride. Expiration date's good, 6/29 or 6/20/29. Sodium chloride 0.9%, 6/20/29. Both. This is an 8 ml one, and this is like a 9.5 ml one. So this should be perfect for our application. I'll also grab this chlorhexidine one-step prepper. So this is what I'll use to clean off the skin. I'll grab some of these gauze pads to help clean up a little bit of the blood that spills over. This soft tourniquet, this J-loop, or extension tubing. So now this one would be wrapped up in this container, all nice and good, and then it would be totally sterile so that when we open it, everything inside is all clean and sterile. I see that this one is not, is just open, so this one's open too, but I'll say that it's all sealed up, and we'll use that one. Then we'll also need this, and that. Great. We'll also need some tape. So we'll grab some of this tape. And I just like prepping my tape before I go on in so that it's easy for me to grab. And this will help secure that J-loop to the patient's skin once the IV's in. Alrighty, we'll continue on. And so we have all of our supplies. We'll go and meet the patient. We'll say, knock, knock, knock. Hello, Mr. Frank. Do some hand hygiene as we enter the room, provide for privacy. Hi, my name is Tate. I'll be your student nurse today. Can you tell me what your name and date of birth is? They'll say Frank Miller. Great, Frank Miller. It says on your wristband. What's your date of birth? 7/4/1958. 7/4/1958. Looking good there. MRN number 000911634 is matching up with what I have in here. Great. It's all looking good. It says here, Frank, that you're allergic to penicillin and atorvastatin. Do you have any other allergies? No. What allergies do you have? The penicillin and the atorvastatin? Great. Well, we won't be giving you those, but what we will do is insert a peripheral IV. What that'll do is it'll allow us to deliver you some medication through your venous system, through your veins. So we'll start that off. Do you have a preference on which arm that we use? Have you had this procedure done before? Yes. Awesome. We'll use your left arm since I see that this one already has an IV in it. So we've got all of these supplies. We're going to come on over and grab some gloves because we'll need these later. Got some gloves there. See that you have your nice arm here. First, what I'll do is I'll assess the vasculature and look for a good insertion site. So throw on some gloves, just because I'll be touching your skin a little bit. Nice. Okay. Oh, and this one ripped, so I'll get a new one. Alrighty, Frank. So, once we get this on, I'm going to use this chlorhexidine scrub to clean up where we're going to be inserting an IV needle into, okay? First, we'll assess the site. This is the vein that we'll look for. No swelling, no edema. It's looking pretty good. We'll use this chlorhexidine prep. We'll crack it. Click. Rip this on open, and we're going to scrub for a good 30 seconds. 1,000. At this time, I could be asking if he has any pain, how his night went, if he's hungry for anything, if he caught the big game on the TV last night, just seeing how he's doing overall. We should be good. Awesome, Frank. So this will go in the trash. Then what we'll do is, while this is letting itself dry, we're gonna prep some of our supplies here. So first, what I'll do is I'll make sure that all the air is out of these IVs, or I'm sorry, out of the saline syringes, and it's looking good here. We're gonna take our J-loop extension tubing and kind of twist off the end of this piece here so that it's easier for us to remove once we get it all the way out of the packaging. We're gonna open this up ever so slightly in the top and expose this blue top where we'll insert our saline flush right up in here. And then we'll prime this line with some normal saline. Great, you can see that the saline flew through, or it flowed on through. We'll put this off to the side here. After that, we're gonna set up our Tegaderm. So this is the sterile one. So we're just gonna peel this on out. We wanna keep the sticky side as sterile as possible. We want it to be sterile. So what I'll do for this is I'll just kind of place a little finger down here, peel this off, and then keep it off to the side. This can go in the trash. Can you come over on this side for my IV insertion, or wherever you think is best? Great. I'll move some of my gauze on over here, and then I see that it's all dried up, so we can insert that IV. We're going to use this nice soft tourniquet and go up and around this arm. We'll leave this tourniquet on for no more than 2 minutes. 2 minutes is the maximum. Good. All right, so that's on. You can grab our IV here. Open her on up. Good. All right, Frank, you might feel a small little poke here. We're gonna go bevel up, making sure the skin's taut here at a 10 to 30 degree angle. Great, we have a flash, lower the angle, go in 1/8 of an inch, then start to advance that blue hub towards the insertion site. Great, we're gonna stabilize that. Safety, this will go in the sharps container. Tourniquet's off, applying digital pressure up here. We're gonna grab our saline and just use our fingers to bring that off. This is a sterile end. Gonna tighten this onto the hub here. Great. So now that stops the flow of blood coming out. We're just gonna readjust here. Good, and use some of our gauze pads to clean up all this blood down here. Good. Now what we'll do is we'll use this Tegaderm to secure this in place. So I'm just gonna move my finger back a little bit so that I can get as much as that blue catheter secured here. Not touching the sticky end. Just gonna grab this little side piece. Slowly, we're just gonna apply this onto here. Great, making sure that this hub isn't on. Good. We'll peel this down and around here. Awesome. And now it's secure. So then what we'll do is we'll save this for later. We're going to date and time that. We're going to aspirate for some blood return. You can note that there's a little bit of blood in this line. So then after doing that, that means that we're in the vein. We're going to pulsate 2 to 5 mLs this normal saline through his IV. For this scenario, I'm going to give 3. Great. After doing so, what we'll do is we'll clamp this here. Clamp, clamp, clamp. Good. After clamping, we can take this on off. This will go in the biohazard container because it might have a little bit of blood left on it. And then what we'll do is we'll grab a piece of our tape here. Oops. Put some tape on there. Put some tape on here. And then that should keep the J-loop all nice and secure there. Then we're going to take our pen here. For this part, the IV's pretty much all good. We'll throw this off, take our gloves off, do some hand hygiene. We'll grab this and date and time here. Date is 9/15. Initials are TS, gauge is a 22. We'll use this little sticky piece to mark our IV insertion on that Tegaderm. Then afterwards, we'll go back into our chart here and document 22 gauge IV needle, and that it was the first attempt. Tegaderm is the dressing on it. Patient tolerated the procedure well, and that's flushed out well, and that it took us, one attempt, and it's in his forearm. And then the date and time also, we'll do the date and time 9/15, and then TS, and then student nurse. Great. Awesome. That should conclude it. Thank you.